We'll become very strong in part A now. Today we'll try to become stronger in part A. Yeah. We'll become very strong in part A now. Yeah. So, yes. Question number 1. Had his first serious attack while on holiday. Pain in his dash body part. Pain in his dash body part. Yeah, some body part. Maybe right hand, maybe left hand. Okay, something. It may be left and right also. If it is only one, there is okay. Okay. The chest. Okay. The forehead. Like that, one part. If it is two parts are there, two different are there. So legs, hands. Then you have to say left leg, right leg, or both the legs. Okay. Right. Yeah. Question number 2. Initially thought it was either dash. Okay. Initially thought it was either a dash. Okay. What it might be. Think about that and write down. It was either something or something else. Pain in his body part. So noun. Second one. It was either something or something else. So something noun again. Possibly related to medication for dash control. For dash control. Okay. For controlling something. Control something controlling something. What is that something? For asthma control or diabetes control or something else control. Anything it might be. Yes, question number 3. Okay. So brainstorm, please. Next. Question number 4. Describes the pain as sharp, piercing, burning. Mahvish, no capital letter. Mahvish, no capital letter. Romasa, why slash? Okay, no need slash. Describes the pain as intense, moderate, mild, throbbing. Okay. Kiran Kaur, why capital letter in the middle of the sentence? Rewrite with small letter. Yes, question number 5. Buringa. What is boring? I don't know. We have to write a new dictionary now. It's burning, not boring. Okay, question number 5. Was unable to dash. Unable to do something. Pain described as adjective. Was unable to do something. Unable to stand, unable to walk, unable to jump, unable to skip, unable to sleep, unable to something, do something. Okay. Next one. Question number 6. Says the clinic initially suspected dash before diagnosing gout. Suspecting something before diagnosing gout. Arthritis maybe. Yeah. Sprain maybe. Yes. Fracture maybe. Kiran Kaur, Spaina. What spelling mistakes you are writing, Kiran Kaur? Earlier you wrote boring, and now you are telling Spain. Careful, ne? Careful. Will you do this mistake in the exam? It is no use. You lose your mark, definitely. Yeah. Next one, question number 7. Reports previously feeling similar pain after dash. Maybe after waking up, maybe after playing football, maybe after traveling to distant places, after work maybe, after sleep maybe, after eating maybe, after doing something or after something. So maybe noun or verb. Yeah. Next one. Question number 8. Dash medicine or medication. Yeah. Not effective. Yes. Medication not effective. Physiotherapy. Why capital letter? No need of capital letter, na? It's a bullet point, not in the beginning. It's continuation of received, not received physiotherapy. So continuation of that one. So it should be small letter. Okay. Yeah, colchicine caused dash. What did it cause? Caused something. Maybe irritation. Okay, maybe tension. Question number 9. Colchicine caused what? Colchicine caused something, some problem. What is that problem? So noun again. Rash, itching, very good. Next one, question number 10. Dash, name of some medication, caused nausea, may have overdosed. Write some medications. Painkiller is one word or two words? Kaval? Painkiller is one word or two words? Kaval? Yeah. Painkiller is a single word. Okay. Next question. Question number 11. Dash, quite effective. Which medication? Medication, quite effective. Okay. Medication, quite effective. Next question number 11. Yeah. Next question number 12. Allopurinol caused some problem. Allopurinol caused some problem. Number 12. Romasa, what is the spelling of problem and what is renal problem? Two words or separate word? Okay. Right. Yes, come on. We are playing the audio.
Each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a rheumatologist talking to a patient called Harry Davies, who suffers from gout and is attending for a medication review. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Now, Mr. Davis,
Yep.
I understand your GP has referred you to me so that we can review the medications you're taking for your gout.
That's right.
So, tell me a bit about this gout. When did it start?
Well, my first serious attack was last year. My wife and I were on holiday and I woke up one morning with a really bad pain in my left knee. Well, I never thought of gout because I always assume that just happens somewhere like your big toe, and anyway, I'm only 40. I thought it was something only old people get. So anyway, it was all red and swollen and I decided it must be an insect bite. But I couldn't think how that might have happened, without me feeling something at the time. Or my wife suggested it might be something to do with the pills I take for my cholesterol.
Unlikely, I think.
But anyway, the pain didn't get any better. In fact, quite the opposite. I started to get frightened because I thought it might be a sign of something really serious. It was excruciating. So my wife thought I needed to get some help. So she phoned the local clinic and told them about my symptoms. They told her to bring me in. It was a good thing she was there. I was in too much pain to drive. I mean, I could only just manage to walk from the house to the car. Anyway, when we got there, the doctor took a look and said he wanted to take a blood sample. He said it might be an emergency because it looked as if it could be septicemia. So then we got really frightened. But about an hour later, they came back and said no, it wasn't, thankfully. But they thought I had gout. So actually, at that stage, we were quite relieved.
Yeah, I can imagine.
And the doctor asked if I'd ever felt anything like it before. Well, actually, then I remembered that in the winter, I play quite a bit of rugby and sometimes I'd get some soreness in the same place the day after, but I just thought I'd sprained it or something, and it would go away after a couple of days. But this pain's much worse, and it comes even when I've been resting. I've had it quite a few times since my first attack.
Right. So, what have you been taking to deal with the pain?
Well, at first the doctor at the clinic suggested I took some anti-inflammatories, but I can't say they made much difference. So when I got the next attack, I was at home and I went to my GP. She suggested I took, I can't remember the name, Col something?
Colchicine?
That's the one. So that dealt with the pain better, but it gave me awful diarrhoea.
Yeah.
I'd never take it again. And then I had a really bad attack. I think the doctor had got to the stage where, she was already giving me really powerful medicines to no effect. So she gave me liquid morphine to take. It made me feel quite sick, actually. And I was a little bit away with the fairies, walking around not quite knowing where I was.
Right. Did you try any other sort of treatment apart from the medications?
Yes, my GP said I could try using an ice pack, and that did make a bit of difference, but you can't have it on all the time. So anyway, after that, she said, let's try allopurinol, see how you get on with that. So I started taking that, but I didn't get on with it. It gave me a skin rash. So I rang her up and she told me to stop taking it, that I'd better see a specialist. So here I am. Is there anything more you can do?
Well, I'm sure we can find something, maybe a combination.
Yeah. So now we'll go for the answers part. Yeah, check your answers, please. Number 1, left knee. Number 1, left knee. Number 2, insect bite. An is there or not there, no problem. Insect bite. Insect bite. Insect bite. Insect bite. Number 3, cholesterol. 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 Check your spellings carefully. Number 4, excruciating. Excruciating. Yeah, number 5, drive. Number 5, drive. Number 6, septicemia. Septicemia, 2 spellings. Septicemia. Number 7, rugby. Rugby. Number 8, anti-inflammatories. 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 Next one, diarrhea. Awful is not there also, no problem. So Rumasa said playing rugby. Playing rugby. So let us check that one afterwards. Yeah. So next one is diarrhea. Next, number 10 is liquid morphine. Liquid morphine. Next one is ice pack. Ice pack, important one. Next one is skin rash. Skin rash. Yeah. Update your scores out of 12. Update your scores out of 12. So now let us go for total 24 out of 24. Total out of 24. Yeah, update your scores out of 24. What is okay, Ram? I wrote ice packs and ice pack. So let us check. 11th one, yeah. We'll check it out. So Romasa and Ram. So question number yeah. Question number ice pack. Yeah, an ice pack. 11th one, right? 11 ice pack. An ice pack. An is given in bracket. So an singular ice pack. Ice packs. Yeah, you will get this mark. You'll get this mark. 85% you'll get this mark. Next one, playing rugby, you told, na? Ramasa. 7th question. Reports previously feeling similar pain after dash rugby. After playing rugby. After playing rugby. Rugby is important. Yeah, after playing rugby, yeah, you'll get this mark, Ramasa. You'll get this mark. Yeah. So now let us check. I want to ask you your opinion now. Okay. I want to ask you your opinion now. Right. I want to ask you your opinion now. Yeah. Now, shall we concentrate on part A only today, 2 more texts, or shall we go for part B and C? Shall we go for part B and C? All of you. Shall we go for part A or shall we go for part B and C? So from tomorrow onwards, I am going to schedule one listening every day. So you can just go to my link and you can do the test. Every day I'll give you one new test. Okay, I'll send you the link. And you can even check the marks and answer. So B and C as well. Okay, right. We'll go to B now. So get ready. Part B. So part B. Yeah. Part B. Yeah, here is part B. Edit. Part B 1 and 2. So fine. Right. Yes. Yeah. Full screen mode. So question after question. Question after question. Yeah, we already started this one. No problem. We'll take another part also. No problem afterwards. But let us finish this. Yeah. So this is question number 25. Think about all the possibilities. Think about all the possibilities here. Yeah. Think about this very carefully. You hear a patient talking to a dental receptionist. How does he feel? Okay, dental receptionist is a female. So the patient is male. How does he feel? So how does he feel? He feels worried, disappointed, and nervous that he may have a damaged a filing. So damaged a filing. So filing is a problem because he damaged and he's worried. Filing, filling. Damaged a filling. So dentist, dental filling. He might have damaged. So filling is the problem here because he has damaged. Disappointed that he can't be seen immediately. So delay is the problem here. Delay. Nervous about being treated by a different dentist. So dentist is the problem. This it's not the same dentist. Another dentist is the problem here. Okay. Another dentist is the problem here. Okay, filling is the problem because he damaged it himself. Disappointed that he can't be seen immediately. So the clinic is very busy. So not immediately. Okay. Not immediately. Delay is there. He has to wait. Okay, next one. Nervous about being treated by a different dentist. So different dentist, not the same dentist. So dentist is the problem here. First one, filling is the problem. Second one is time is the problem. Third one is dentist is the problem. Focus on these three different words. Focus on these three different words.
Had all the injections, typhoid and what else? Not yellow fever because.
Reaction to certain drugs.
Oh.
But we'll need to do some more tests first.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a dental receptionist. Now read the question.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we'd get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
OK, we'll book you in for tomorrow morning at 10.
Question 26. You hear part of a presentation to nursing staff about an extension to visiting hours. Now read the question.
Now, you'll have received the survey asking your opinion about extending visiting hours, and doubtless you've got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on patient recovery rates of increased contact with loved ones. This isn't in question, but of course things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough on your plate without having to worry about extra demands from visitors. Well, we've carefully planned things to prevent you being overrun with queries, interruptions and so on. Visitors will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
Question 27. You hear a surgeon discussing a patient with a nurse in the recovery ward. Now read the question.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
Question 28. You hear a chiropractor briefing a colleague about a patient called Ryan. Now read the question.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time, how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
Question 29. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. Now read the question.
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risks, maybe an hour or 2. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Question 30. You hear a surgeon talking to a patient who's just had a knee operation. Now read the question.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Good.
Give it 4 months before you put any serious impact on it, though.
4 months? After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
That is the end of part B. Now look at part C.
Now let us check the answers. Yes. Part B. A. Part 26B. 27B. 28C. Yeah. Yes, that's it. Check your answers and update your scores out of 6. Scores out of 6. Scores out of 6. So total out of 30. Total out of 30. Yeah. So now let us see the next phase. Now what I want to ask you is, yeah. So how are these test styles? We are doing like this test, na? Or shall I give you test like this every day? One test. Every day one test. We'll fix the time. And exactly every day one test. You will find out your scores and you will evaluate, because question paper answer sheet also will be given. Every day we'll do one. And those who are going for exam this month ending, you can do 2 tests, right? So one on your own and one test like this. And afterwards we can have some doubts. Okay, anyone has any doubts, you can ask me in our regular class. Yeah, Tuba, you wanted to join. You, I think your friend has adjusted that, so you can. I'll add your name in the regular group. Yeah, Canada group is increasing now. 1, 2, 3, 4, 5 students. Yeah. So now I want to ask you, shall we go for part C now? Yes or no? Or I'll give you one full test. I'll show you how the test will be. Full test. Maybe you have done earlier also, no problem. You do full test. How many marks you are going? Try to get 42 out of 42. Okay, there is no excuse. Ready? Write down. 1, 2, 3, 4. 1 to 12 one side and another page. 13 to 24 and then All write down till 42. Come on, we'll do a full test now. I'm going to give a test now. Serious test. Yeah, you have to get the scores also afterwards. Scores also are there. You have to find out. Let's do it. Today we'll do the first test. Like this test only, I will sit down in the night and prepare everything and I'll give it to you. If you like this type of test, which I am going, now this is nothing. That test which I am going to give now is a full test for 42 questions without any stop. Everything will be there. Get ready. Yeah, 10 members. Yeah. Get ready. Write your answer. Question numbers 1 to 12 one side, 13 to 24, then 25 to 30, and 31 to 36, and 37 to 42. Write all the numbers and keep them ready. Write all the numbers and keep them ready so that you can write. Yeah.